over 20 seminars on many different aspects of the research process. And if you haven't attended one of these before, they're very much a rapid overview of a very big topic in just an hour, and designed specifically for very busy clinical people trying to learn more about research and research methods around the margins. Because we record and we have people listening in from all over Western Australia, we'll ask you to hold your questions to the end, and if you're offline and joining in, please turn off your microphone and your video, and if you have any questions, type them in and I'll bring them up at the end. Please also fill in your evaluations at the end if you can. We have an online link, and that's at the back of your handouts or at the end of the slides, and we really do value your feedback. We're constantly trying to improve what we do. So in a moment I'll introduce Anne. This is personally for me an extremely important topic and something that every researcher needs to get across as soon as possible if they're not already involving consumers and community in their research. And we're very lucky to have Anne McKenzie today to speak for us, which she's done before, of course. Anne's a powerhouse of consumer and community involvement, and she was the very first parent advocate back at Princess Margaret Hospital in 1994, and from there has gone on to establish the Consumer and Community Health Research Network, which is an enabling platform at WAHTN. She is former chair of the Health Consumers Council of Western Australia, and she continues to be a senior consumer rep for many state and national health committees. And currently Anne is manager of consumer engagement at Telethon Kids Institute. So without further ado, I'd love to welcome Anne back to speak to us today. Thank you.
Thanks. Hi everybody, thanks very much Sue for having me again. Let me work out the technologies. It's arrows, isn't it? Or can I use this? Always have difficulty with the technology in the different places, so can I use that?
Just use those. Oh,
no.
Is it not going down? Okay.
There you go. Okay, so thanks very much for having me today. I really like coming and giving a quick overview, and a quick overview it is. As Sue said, I'm now the Manager of Community Engagement at Telethon Kids, and it's a much wider brief than involvement, but today we're going to be talking about involvement. We're going to talk about the foundations of involvement in research. What are the barriers? So what it is that's stopping people from doing it. If we were doing this in a face-to-face exercise, I'd now be asking you to please put your hands up to tell me who's actually involving consumers. So not enough of us in the room to be actually doing that. And then where there's some help and advice for you to get moving along. So the definitions that I'm going to be using today may be not particularly familiar with people, but possibly should be if you are doing research. Consumer refers to people who directly or indirectly make use of a health service, and that is patient, potential patients, carers, etc. And basically all of us are consumers, but when you're doing your research, you need to remember that you've got your researcher hat on, or your clinician hat, and that you shouldn't be speaking on behalf of consumers. Consumer rep is someone who belongs to a committee and might belong to another organisation and can bring the perspective of a wider organisation. Community is a group of people who share a common condition or interest, and a really good example of that is Aboriginal people may have similar health issues across Australia, but they don't necessarily live in the same geographic location. And then of course there's stakeholders, who are people that, or groups that have an interest of in the research that's being conducted, and they might be internal or external people. So, and I'll talk a little bit more about stakeholders. Now these definitions, as I said, you may not be familiar with them, you may not prefer them, but they are the definitions from the National Health and Medical Research Council. So for the purpose of research, we use them. Some labels. There are lots and lots of different labels that people use. There are community members, there are citizens, advocates, consumers, lay members, whatever. It doesn't really matter which label you use, although, as I said, it's preferable that you use the NH and MRC definitions. It's about putting the person before the label and making sure you have that community voice in your research. So a lot of people say to me, well, my research is about nurse workforce or GP workforce in country areas, so it's not really about what's about patients or consumers, it's more about those groups. And so here we've developed what we call a stakeholder wheel, and these are all the people that are involved in research. And as you can see, there's researchers, consumers, community members, commercial, funding, clinicians, whomever. There's a wide range of people who, are involved in research. But often what happens is that people speak on behalf of these people, consumers and community members. So they are left outside the decision-making table. So it's really important that you have that voice in your research. So right up there, sitting up there with the biostatistician and the research nurse, that they're sitting at the table having a say. So what is consumer and community involvement? It's about having the community at the decision-making table so that all of the decisions around research are informed by what's important to the ultimate end user of your research. It's about working in partnership with the community, and these partnerships being sensitive to the needs of the community so that you make sure that you're actually really addressing the needs of the community. Community members are part of the process, and you're conducting research that is with the community rather than to them or for them. And for anyone who's worked in the disability area will know there's a long time mantra that says nothing about us without us. And I think that that is really relevant to all areas of research, right from the lab-based research through to the research that's at the bedside. So what it's not about is researchers just raising awareness of their research. It's not about the participants, or you may, in an old-fashioned way, refer to them as subjects of your research. It's not a recruiting tool, or although often you may have consumers that can bring other people into your area of research because of their networks that you may not necessarily tap into. It's not an opportunity to tick the box. It's not about fundraising or public relations. Although all of those are part and parcel of the whole research journey. Today we're talking about the value and inclusion of consumers in research. So this is a really important thing, is to be very clear about what you're talking about. And a good acronym, although I'm not really big on acronyms, to think about is PI. It's there are people that are participating in research. As I said, you may call them the subject, I hope you don't, but they are the participants in research. Consumers, consumer involvement is where people are informing the decision around research, and then of course is engagement, where researchers are and research organisations are having a conversation with the community about the research that they do. And a really good example of that is the Telethon Kids Institute. They have a machine about talking to the community about the research that they do. But we're talking today about involvement. So why is it important? There can be lots of reasons why it's important, but the main thing is about you be getting the whole picture if you have the community voice in your research. And some of these key reasons, I think there are 5 key reasons. They're not necessarily in order of importance, but they may be depending on what it is that you're doing. So it could be funding bodies require some form of involvement, and more we're seeing funding bodies require involvement of the community in the grant application development right through to what's happening at the end and how you're going to translate that into policy and practice or get your message out to the wider community. So there's 5 things there, and I'm going to quickly run through those. Funding, government or policy requirements. Those of you who work in the cancer area will know that you cannot get research funding anymore unless you have consumer involvement right the way through. In your grant application, it's the consumer involvement section there's a criteria for it, which is judged and it's scored by consumer reviewers, and then that forms part of the whole process. So Cancer Australia have been really, responsible for raising the awareness of and the value of consumer input into their research. Likewise, the National Health and Medical Research Council has a framework and a statement, and this year, or last year I should say, there were requirements in the grant applications for clinical trials and cohort studies. Researchers were required to say how they were going to involve consumers in their research, had they been consulted, and how they would have an ongoing role. And with the ideas grant, specifically around Aboriginal people, there were requirements for you to say whether you consulted with Aboriginal communities. And in actual fact, you wouldn't get funding from the National Health and Medical Research Council for research with Aboriginal people unless you had that community involvement, so that they had a say in what was being done for their community. So I think more and more and more, the Medical Research Futures Fund, which is a huge amount of money put aside by the federal government for research, and they have calls for research, and they have a question in there about how community has been involved in the development and ongoing part of your research. So I think more and more we are aligning ourselves with other countries where you wouldn't get funding without meaningful involvement. So I believe consumers can improve the quality of research. They live with the condition that you are researching, or they access services that you might be researching. Health professionals, you might be talking about how nurses deliver service, and ultimately they are the end users. So they do know things that you may not know unless you have the condition, and even then I would say to you it's quite difficult to have the two hats on. So it's good to have the community voice that's not associated with the organisation. So, and there's a comment there from a researcher down at UWA a few years ago, did research with a surgeon on leg ulcers, and we held a community conversation. It was quite difficult to get people to come to this community conversation, and what I hadn't factored in when we were trying to get people to come was the lack of mobility for people with ulcers, particularly leg ulcers, and about how that made them be at home. And the biggest thing that came out of that when we did finally have it was that they were talking about depression. And that was something that the researcher and the surgeon hadn't even thought about when they were considering doing a trial around leg ulcers and around pain in leg ulcers, and that certainly hadn't been brought up in the literature that they were looking at. And so that was really important for them to be able to think about the lack of mobility and the ongoing and onflow of effects that had on people with that condition. So, and as he says here, I knew there was issues that were common, but he hadn't thought about it, and the rest of that is where he actually says, researchers know lots of stuff, but they don't know everything. So that was a great comment from him. So if you work in a health service, and I'm assuming that most of you do, it is an accreditation requirement, and very shortly clinical trials will come under the same accreditation standards, where the second standard from the Commission, the National Safety and Quality Health Service standards, the second one is partnering with consumers. So clinical trials will be accredited exactly the same as the rest of the health service. So in your trial you will need to be able to say how you have involved consumers and partnered with them in your research project. So that's something that's coming very, very soon, and that is something that it's worthwhile you all knowing about if you work in a health service. So ethics committees, and they are often thought to be a problem for researchers, but I would say to you that if you have had community involvement in the development of your research project, it is so much easier to put in a lay summary or how you are going to involve the community in your research. And I have an example from someone who was doing research here in WA, and she was talking about the water quality in Western Australia and the chemicals that were in the water, and was that having an impact on birth defects in Western Australia. And she put in her ethics application. She'd actually consulted with an advisory group for the West Australian Congenital Anomalies Reference Group. It used to be called the Birth Defects Registry, but people with children that had disability and what was classed as the birth defects didn't like that title, so they changed it. I think it's even harder to say. But anyway, they had an advisory group, and this researcher had consulted with them about her project, because they would be using data from this registry. And so she put her application in, and the ethics committee at, I think it was UWA, didn't like the word chemical in it. They thought it was frightening, and people in the community might be very worried about chemicals in the water. So she came back and talked to me, and I suggested that she went back to the advisory group. And what everybody said was, in actual fact, if you didn't use the word chemical, we would be worried about it, because anyone who drinks water in this state out of a tap knows there's a huge amount of chemicals. You get it to your nose, and you certainly can smell the chemicals. And they felt, it was really important to be honest and upfront about what she was actually studying. So she went back to the ethics committee and said she had consulted with the advisory group, and their advice was to keep the word chemical in there, and it went through. So I'm just saying to you, I can't promise that it makes a difference, but I am saying to you that it's quite hard for an ethics committee to say we disagree with the community about that, so long, of course, that your research is safe and covers all the things that it should do. It's really difficult for them to argue with the community thoughts. Something that, if you haven't read, the National Health and Medical Research Council has a Roadmap 3 for working with Aboriginal communities and keeping research on track, version 3. So I think there's something that I would point you to have a look. What you don't need is ethics approval for consumer and community involvement, any more than you need to have ethics approval to bring any other member of your research team on. It's not research, although you might like to get ethics approval and include the consumer reps on your application, because then you can publish about it. And but you do not require ethics approval for involvement activities. So it can help empower people. There's lots written up and published about how important it is for people to feel involved and empowered about their own health, and it's exactly the same as research. And really what's going on now, I believe, is where the community is empowered. People know about COVID, they know the value of research, they're really hearing about research in a big national way that we've never heard before. So I think research is having its moment in the sun, but I would also say to you that think about what's happening in Victoria, where there was not really good community consultation with certain sections of the community, and where they're having a spike because of that lack of consultation. So I would really say to you that it empowers people. People want to be involved, and they want to contribute to research if they're given a chance. And it's about the benefits of support and advocacy for making sure your research is translated into policy and practice, because ultimately that's what should be the aim of all research that's in health services. So the underlying principles, I don't really need to go through these very much, except to say to start involvement as early as you can and treat consumers and community members exactly the same as your other team members. You would keep them informed, you would talk in language that's understandable to them, and you would treat everyone with respect and integrity. And one size doesn't fit all. Every research project is unique and needs its own unique involvement activities. So I'll just ask you to consider that. The benefits, as I said, it's openness and accountability for the use of public money. If you are using research, if you are accessing research funds that comes from taxpayer dollars, it's really important that you are open and accountable about the end result of your research. And as I said again, the community now is really informed about the value of research. Policy makers and government are more informed about what's important to the community, and you will have heard there's a national research committee advising the federal government about COVID and about what's important to them. And we're really fortunate here at Telethon Kids to have the director who is a member of that committee, and to be able to say to him that this is what's important to community in this COVID space. So it's all very fine for me to stand up here and tell you about all the benefits. What are some of the barriers? And these are real and something that you need to think about before you get started, or even as you are going along, because there are barriers to implementing involvement, and they may be simple things or they may be very big. Way back when, probably several years ago now, we did, and it's a royal we, it was a team that I was working with at UWA and Telethon Kids, and we did a small research project and asked researchers who were involving consumers what were those barriers for them, and they haven't really changed in the intervening years. And of course it's time and money, people don't have the time, there's a lack of training and confidence, and that's why it's great to be invited to speak to you at seminars like this. There's a lack of coordinated approach from the funders and rewards. Unfortunately, the only way that you can say that you've done fantastic involvement is to put it in your track record, and what that counts for in the overall scheme of things, I'm not sure. So I've been sitting on the National Health and Medical Research Council's Community Advisory Group for a couple of trimesters now, and I'm always saying, why don't we reward people who do a really good job of involving the community rather than sticking it in and getting it lost somewhere else. And some researchers see it as a loss of position and control or power. And I would say to you that you are the boss of your research, you are the person that's in charge, and you need to work in partnership with consumers so that you don't feel that you lose anything by having consumers on board, and in actual fact you gain a lot. So implementing involvement is always somewhat a bit difficult for some people, but I would say to you, start small and, get some wins on the board, create a community of people around you that are keen to be involved and will help you. So planning for involvement, it's like any other part of your research. It's crucial that you do it, and to ask yourself why you're doing it, what you want to achieve, what level of involvement are you aiming for? Do you want to have it only in one part of your research or right the way through? Be clear for yourself about the sort of things that you're looking at. There's some resources that I wrote with a UK colleague, and they're available on Telethon Kids website at that link, or they're also available on the Consumer and Community Health Research Network, and I'll give you the link for that in a little bit. So there's stages and levels of involvement, and this is where I say it's really important for you to think about what you're doing. We have developed some tools over the years, and I'm just going to share those with you quite quickly. So the first thing is the research cycle. You need to make a decision about, are you involving consumers where you're deciding what you're going to research, and at the beginning. And these are not necessarily in an order, because you can start anywhere anywhere, and even if you have started and you have no involvement, it's not too late to start. You might have consumers helping you decide how you're going to do it. And, you know, particularly if you're running a trial in a hospital and you want to invite people in, you need to think about things like here in Perth, parking is difficult. If you park in the multi-storey car park, you'll be lining up for some time to get in, and if you want people to be in there at the time that school's starting or they need to get into that car park, you need to think about those sort of things. So it would be good to talk to some people about that. Doing it as you analyse the data, depending on what you're doing, you might ask consumers if there's any blips in what your results are showing. You might again consult with consumers about that, letting people know the results. It's important to publish in academic papers and attend conferences, although none of you'd be doing that at the moment unless you're doing that virtually. It's really important to talk to community members about how they can help you get your information out to the wider community. And then, of course, priority setting by knowing what to research next, so that, you know, it's important that you know what's important to the community. And often there is a mismatch between what's important to researchers and clinicians and funders to what's important to the community. And if you look up the James Lind Alliance in the UK, you'll see that they've done a lot of priority setting partnerships, and there's also publications there about those mismatches between what's important to consumers and what's important to researchers. So there's various levels of involvement, and we used to have a ladder of involvement, but we've now moved to a spectrum of involvement, and I see that there are 5 places where you might decide to involve consumers. So this is the level of involvement. Do you want to inform them about your research, where you might have a wider group of people? Are you going to consult or ask them to advise you? They might be equal partners, and in some instances, particularly when you are working with Aboriginal communities, they may lead the research, because that's you know, some way that it works best, where they're seen in their communities as leaders of the research. And sometimes even community groups will come to you and say, we've got funding for a research project and we want to be equal partners or lead and decide what it is that's going to be researched. So it's really important for you to be clear about the stage and level of involvement you are seeking, to use frameworks and tools. There's lots and lots of them around. I've just shown you the 2 that work well for us over the years, and it also helps to support consumers to make a decision about whether they will be involved in your research, particularly if they're sick or they've got a sick child. It's really sometimes quite difficult for people to come into a health service like here or wherever else. And since COVID, of course, we've seen an uprise in telehealth, and we've also seen, you know, a huge uptake of using technology for meetings and all sorts of things. So, you know, it's really important to look at alternatives about how you can best facilitate that. So in WA, we have, fortunately, one of the best practice models for involvement of the community in research in the world, and currently there are hundreds of people involved in decision-making activities across WA, and they are, include people reviewing grant applications, commenting on patient information sheets and consent forms or plain language summaries. They're attending forums, events and training workshops, and they're serving as consumer representatives or research buddies or on advisory committees, councils or steering groups. So there's a huge amount of activities happening across WA. So it's up to you to see if you can actually have some time to you know, engage in some of those activities. So I just want to talk quickly about the importance of plain language. Researchers have what I consider to be research speak, and over the almost 2 decades that I've been working in this space, I've often felt like I've landed in an alien country or planet, and people talk about things that I think, I don't know what on earth they're talking about. So I'm quite able to say, excuse me, I don't know what you're talking about, but that's not always easy for a consumer or community member to do. So be really aware of the importance of plain language. Using language that is not easily understood can really limit meaningful involvement. And, you know, as I said, it's a power imbalance. If you're seen to be the smart doctor, smart nurse, or the smart researcher, it's quite difficult for someone to say, I don't understand what you're talking about. So you need to be quite aware of that. And it's isolating for someone in a very strong organisational culture like a big hospital or even a little hospital. You all have in-talk, and it's quite hard for someone coming in to think that they have an equal voice or you're interested in their voice, even if it's not quite equal. So I just want to run through some examples of good practice from here in WA, and the first one that I want to talk about is the RAIN study, and that is a 30-year-old study that started here in Western Australia. It's one of the biggest pregnancy cohort studies or the longest pregnancy cohort study in the world, and many of you may have heard of the RAIN study or indeed used RAIN study data. And this was about originally, way back when, 30 years ago, I think it's 31 actually, years ago, they asked 3,000 pregnant women to take part in the study, and half were given an ultrasound at 19 weeks and the other half were given ultrasounds, I think, every month from every 4 weeks. And they were looking about what was the difference and what was the benefits. And so when I started at Telethon Kids in 2004, I was quite flabbergasted that there are many millions of bits of data and information and samples from this cohort of people that have been researched for 30 years. And I was quite surprised that they hadn't asked the RAIN study parents at that time what was important to them. There was this huge amount of data that was being collected. People were having bloods taken at 5 o'clock in the morning, their whole family, and they were bringing their kids in year after year for follow-up studies, and yet they'd never asked them what they would like to see research. And I remember very clearly people saying to me, oh, we wouldn't want to do that because they might want to know about alcoholism and drug taking and things like that, and we're not really interested in that. We want to leave it to Professor Stanley and to Professor Newnham. And so, but at that time, the RAIN study participants were actually 14, 15, and some of them were 16 because those 3,000 were recruited over, I think, nearly a 3-year period. And the young people said, well, we're interested because it's about us. And so we started up a very small group of people. It was called the T Team because they were teenagers, and they had a lot to say about lots of things that hadn't been thought about. And so then in 2016, the RAIN study, so we went from 2005 to 2016 with this small group of people, and we had various functions and activities where we brought RAIN study participants in to talk to the researchers. But then in 2016, the RAIN study heads decided to, spread their wings and put RAIN study participants and their parents, I think they're called Gen 1 and Gen 2, people on all of the committees across the RAIN study, including the board, the management board. So, really, really exciting uptake of consumer and community involvement across that very important study. And I was just listening to a story about one of the people that was, very early involved in the involvement activities in, the mid-2000s, and is now on the board of management. And she's a doctor, and she said, taking part in the RAIN study certainly piqued her interest in research and medical stuff. And she's got a baby herself, and there are now 600 RAIN study babies. So, you know, there's 4 generations. There's grandparents, there's parents, there's the original babies that were studied in utero, and now they're having their babies themselves. So it's a really important thing, and it's great to see that involvement across all of it. Participate project was a project done out of the rehab unit here at Perth Children's Hospital, which was done at Princess Margaret. There was a project with 5 studies and looking at young people with disability about being able to take part in you know, sport and recreation activities, and they set up a reference group that provided advice for all of the people, all of the researchers that were involved in it, and they had clinicians, researchers, parents, a teenager, and you know, as I said, clinicians and researchers, and they provided advice all the way along for those studies. They actually won an award, an international award, for involving kids and their families in the research. And as you can see, there was a couple of comments there. A mother said that she was surprised that the clinicians and researchers were interested in what they had to say. And then, you know, how exciting that it was that the little boy could take part in sporting activities, and the confidence that, you know, being part of that study gave to them. So, you know, that's an example from here at Perth Children's Hospital. Fetal alcohol spectrum disorder, that is done out of Telethon Kids Institute, but has been around for longer than what I've worked at Telethon Kids, and you know, they have had enormous involvement with the community, particularly in the Kimberley, where the community has led a lot of research around full-strength alcohol and brought down the rates of women consuming alcohol in pregnancy. And so we did a priority setting partnership, and they have a National Centre of Research Excellence. They're part of CARS, where doctors who treat kids with fetal alcohol spectrum disorder, you know, are part of that team, and they have a national advisory group that meets very regularly still, and it's been really fabulous to see people from across Australia be involved in this and have, you know, a huge say in the research that's been done in that Centre of Research Excellence. Lab-based research, just in case there's some of you that are doing laboratory-based research and thinking this is not relevant to you, it is. And people who have got children that have got rare diseases understand that it may not make a difference to their children, but certainly it may make a difference to other children and family members, etc. So, you know, there's research being done in cancer, autism, asthma and cystic fibrosis, just to give you a bit of an example of all of them. So the BEAT CF trial, that's of course BEAT cystic fibrosis, that was the first Western Australian project that got money from the Medical Research Futures Fund, and they have really, really strong consumer involvement. They set up 3 national advisory groups, one for young people, one for parents and partners of people that have cystic fibrosis or children, and then of course there's adults that have cystic fibrosis, and that's a collaboration between Telethon Kids and CARS again, and you know, that's been really good, and the advisory group have provided advice about dynamic consent and, you know, all sorts of issues. And just very recently I heard someone with cystic fibrosis, who's a more mature gentleman, say, we've been practicing social distancing forever, so, you know, welcome to our world. I just want to share lastly a COVID-19 community advisory group that we set up out of Telethon Kids, and this is for COVID research. We heard in March that there was limited involvement happening in rapid research projects that were happening. So we established a national reference group. It has half of its members are from Telethon Kids, of course, because we are, running supporting the advisory group's a better word, and we have then we've got reps from all of the other states, and there's actually 3 from New South Wales. So that's a 20-member group that is advising on COVID-19 research, and so far since April it was put together in a week. We didn't do what we would normally do, and that's advertise those positions because of the rapid need that was presenting itself to have community input into research. And so they've had input into 18 projects, they've had 9 virtual meetings, and they've really given a huge amount of input into research projects, either in the virtual meetings or in other meetings via email, and some people have even been meeting. So there's over 260 cumulative hours, and I believe that this is one of the few community advisory groups in the world that's been established for specifically for giving input into COVID-19 research. And they also were able to give a list of priorities for research from across the board of people that are on this committee for future research as we come out of the COVID-19, extreme period. So this is just a couple of words from 2 people who are on that. One is Kath Hughes, who some of you may know. Her baby died about 5 years ago from she was not offered the 3rd trimester vaccine for whooping cough, and so she has become a very strong advocate for vaccines and community involvement in research. And she joined this committee, and Kath, said for her it was really important to see the community cost of COVID was high, and that she thought it was really important that consumers and researchers work together at this time. And again, Amber, who had a baby preterm, and she is sitting on the Scientific Advisory Committee for the joint research I can't think what it's called, the lung research project that's joint between CARS and Telethon Kids, and she is, very vocal again about the importance of it, and that what she's found, that even when the views of the community reference group or community advisory group differed to those of the researchers, it was still taken on board. And I spoke to one of the researchers that has used the services of this group twice now, and he said to me, this was a very robust group that you put together, and I said, well, this is a very robust problem we're facing, so it's important you get some robust feedback. I'm not sure quite what that meant, but I didn't ask. But these are just some examples from around that we've been doing. Some final tips that I would give you: it's really important to have senior level sign off for your involvement activities. If you want to do it and your boss doesn't think it's a good idea, well, you've got a bit of a mismatch there before you start. You need a budget. We certainly advocate paying consumers an honorarium for their time and out-of-pocket expenses. There's training needs. There are training workshops available both for consumers and community members in this state. And you need a named person with responsibility for the involvement activities in your research. And if you're lucky enough, some admin support always helps. So there's some resources. These are available, as I said before, on Telethon Kids website. They're also available on the Involving People in Research website as well. And there's support and available for CARS researchers from involving people in research, and Rhiannon Dean is the person that provides support with CARS. And of course, if it's a joint Telethon Kids CARS project and it's being submitted through Telethon Kids, we would ask that you contact us at engagement@Telethon Kids. So that's me. I just want to finish with some concluding thoughts to say that it makes your research more relevant, accountable, transparent, issue-driven, because often the issues for you may be different to those of the community. Your research will be supported by the community and have greater chance of it being translated into policy and practice if you've got some strong advocates working with you. So thank you very much.
Thank you, Anne. That was absolutely fantastic. It's great to see so much activity in this area, and it's really increased exponentially here, just even in recent times. Does anyone in the room or online have any comments for Anne or any questions? We have a microphone which we can run around with, and I'll just quickly duck over to the laptop and see if there are any there. No? Don't be shy.
I can promise not to answer hard ones.
Has anyone here actually been involved with researchers in their own research? Sorry, with consumers in their own research? Okay. And did you start that involvement partway through or right from the start?
Of the studies.
The meeting
Yes.
is about to terminate.
Yeah.
I think we only jumped on recently, but I think we have a consumer group that we work with, and we meet twice a year, 2-hour meetings with them, and just go through all our studies that we have and get feedback on any issues that we're facing. They give us really good feedback about how we can better engage. And then us studies as well, like how we can go about creating that engagement.
Yeah, that's great. So for people offline, this is a group that is obviously using a consumer advisory group, not just for one project, but for multiple projects, and touching base on a regular basis. And I'm sure that all of you who do go down this path will find it, as Anne said, incredibly rewarding. There's nothing worse than investing lots of time and energy in things that don't matter to our end users, as Anne said. I can't see any questions offline, but I'm sure even if people are feeling a bit shy about commenting or asking questions now, Anne would be very happy to stay behind for a few minutes and have a chat to people if they think of things after we finish. So please take a moment to fill in your evaluation if you can find that. There is a link at the end of your handout, and we'd really appreciate that. And please join me again in thanking Anne.
Thank you.